Counting Down 60 Minutes with Dr. Tajuddin Ogbara. He's a lecturer in infectious diseases at the Midwestern University, Illinois in the United States, and a board-certified infectious disease specialist licensed to practice in the states of Illinois and
How
Indiana.
does one
identify that one has been infected with the virus? And I'm asking that question because I'm told that its symptoms mimic about 6 other kinds of medical problems.
It does, yes. This so-called Ebola virus, as I stated earlier, there are 2 types of viruses. Yes. One is called Marburg, M-A-R-B-U-R-G, Marburg virus. The same class of virus. This initial symptomatology or symptoms of this virus mimic major viral like influenza, flu. People present like flu-like illness.
Right.
They come with fever, joint ache, muscle ache, occasionally weakness, and headache. They feel like they had a flu. That's the first presentation.
Right.
And a few days later, they start having what they call gastrointestinal symptoms, vomiting, diarrhea, and followed by cough. And that's what we normally see with the influenza. We see flu-like illness. But the danger about this virus is when you go through that first, second episode, it goes into the 3rd stage. And that's what killed the patients. That's what killed people.
In other words, if we can identify it at the first stage, when you're still exhibiting flu-like symptoms, there's no gastrointestinal problem yet, it can be cured.
It cannot be cured, but the symptomatology can be suppressed much more. The danger about it is the 3rd stage, what we call it the viral hemorrhagic syndrome.
What does viral
hemorrhagic syndrome? Hemorrhage. People start bleeding.
Inside?
Everywhere, from the inside the body. That's the danger about the virus. As compared to influenza virus, flu,
yes,
we don't get that viral hemorrhagic syndrome. That's the danger about this Ebola Marburg virus.
When you say they start bleeding, through every orifice?
They start bleeding, what happens? If you look at the pathogenesis of this virus,
yes,
after the 1st, 2nd episode, it starts damaging the blood vessels. The blood vessels, we call it the vascular bed.
Yes.
The blood vessels become damaged because the virus attaches to the blood vessel and it starts damaging the blood vessels all over the body. Blood vessels in the eyes, blood vessels in the brain, blood vessels in the lung, blood vessels in the skin. And that is why some patients come with rash. The rash look like dots all over the body. Dots because they are bleeding to the blood vessel. So blood vessel in the stomach, blood vessel in the liver, blood vessel in the kidney. So if anybody comes with anything that suggests they are bleeding,
yes,
that's what the hemorrhage means, bleeding. They are bleeding somewhere. So they can present anyway. They can have blood seeking from the eyes, blood coming from the mouth, blood coming from the urine, we call it hematuria. They can bleed from the rectum, they pass blood like they have hemorrhoid.
Yes.
So they can bleed everywhere, and that's when it's difficult to control the virus at that 3rd stage. Yes. When they start hemorrhaging, which is usually the 3rd stage of the virus.
That's when they die.
That's when people die. But if it can be caught earlier,
yes, giving
them IV fluid, maintain their blood pressure and all those things, it can be controlled at that point. The symptoms to look out for will be fever, head aches, joint ache, muscle ache, weakness that is followed within 2 days with vomiting and diarrhea. And especially if that one is also followed by what we call petechia, which means body rash. The body rash will look like dots all over the body.
All over the body, not just the hands.
Not just the hands. Can be in the hand, but we see much all over. If it can be in the hand, but could be all over the body.
What kind of color will the dots be? Black?
Well, yes, in Africa will be black. Because
dots.
Of our skin.
Yes.
It's nothing but like dots in the body, and that is a big sign to say that this could be Ebola virus. That is, the body is starting to hemorrhage.
Inside.
Body is starting to bleed, and this is manifestation of bleeding in the skin. That's one not to be super aggressive. Yes. In this type of person. That person right away, my advice would be isolated right away. Put in isolation room, single room, and everybody goes in should follow that precaution as that I stated earlier.
All right.